الرحيم. السلام عليكم ورحمة الله وبركاته. أتحدث العربية لأني لا أتحدث الفرنسية. Je ne parle pas français. This is the only sentence I know in French. So أتحدث العربية والمحاضرة باللغة الإنجليزية غالبا يمكن نحاول أن نساعدها ببعض العربية لأنه للأسف ليس لدي أي لغة فرنسية. أتقدم بخالص الشكر للأخ والصديق العزيز الأستاذ الدكتور جمال بالخضير والزميلة الفاضلة الدكتورة كبيرة وجميع الزملاء والإخوة في المغرب الشقيق على الدعوة الكريمة التي نسعد بها دائما كلما نأتي إلى المغرب. مكتوب في البروجرام انه 20 دقيقة، ولكن عندي تعليمات من الدكتور جمال انها تبقى 15 دقيقة فقط، وبالتالي فيعني نجتهد في الصراع اثناءها علشان لا نتعطل. Endothelial dysfunction between diabetes and hypertension. There is a question put in the program regarding the issue of the endothelial dysfunction. And this is my agenda. Endothelial dysfunction and diabetes, endothelial dysfunction and hypertension, then the relationship between the endothelial dysfunction in both diseases. The endothelium is the largest organ in the body. Once it was thought it's an inert sort of system, doing nothing except just a smooth lining of the blood vessels, just to prevent adhesion of the platelets to the wall of the vascular system. And now it is known that it's much more important and complicated than that. And the function of the endothelial cells include production of nitric oxide, the most important agent regarding the endothelial function, regulation of platelet adhesion, coagulation, immune function, control of volume, electrolyte content, intravascular and extravascular spaces. A very large amount of function and very complicated sort of function. The endothelial dysfunction is a systemic pathologic condition which can be broadly defined as imbalance between the vasodilating and vasoconstricting functions of the endothelium. And the basic agent here is the nitric oxide. The endothelial dysfunction can result from several diseases. The more important diseases are diabetes, dyslipidemia, hypertension, and many others. But as well, it can result from environmental factors like tobacco smoking, exposure to air pollution, and many others. Endothelial dysfunction is associated with reduced nitric oxide. I said how important the nitric oxide is. Anticoagulant properties, increased platelet aggregation, the reverse of the functions of the endothelium. And one important characteristic of the endothelial dysfunction is the inability of the arteries and arterioles to optimally dilate in response to nitric oxide. I'll skip that, of course, these diagrams. Just to go to the endothelial dysfunction and diabetes, the first sign of the relationship, which showed the relationship between the endothelial dysfunction and diabetes, was in a study published in the year 1988. It's almost 30 years now when the first evidence of endothelial dysfunction, that was in penile corpora cavernosa in diabetic men when they discovered the relationship between the endothelium and diabetes. It is now known that high concentration of glucose have been associated with endothelial dysfunction. There is an important article actually published in Cell Metabolism in the year 2013. It's a study to determine the prevalence between stress hyperglycemia and endothelial dysfunction. And the conclusion was very clear. Cardiac necrosis as measured by troponin levels, is significantly increased in people with acute coronary syndromes and stress hyperglycemia. So stress hyperglycemia negatively affects the cardiovascular complications of diabetes. And that has a practical implication, actually, because now consistently we are required to measure not only blood glucose, but hemoglobin and A1C as well, because a lot of people who are coming with acute coronary syndromes might have unrecognized diabetes. Diabetic patient developed endothelial very early in the course of the disease, of diabetes. Now it's clear that the abnormal endothelial function precedes the development of structural change of the vessels. The fact that endothelial dysfunction is the earliest pathophysiological precursor of atherosclerosis is very important, because now we have to study the endothelial function in those patients just to be able to protect them, if we can, from development of cardiovascular complications of diabetes. Thus, if acute hyperglycemia does cause acute endothelial damage, now we are facing a problem of a future increase, or large increase actually, in the rates of cardiovascular complications or cardiovascular problems. Interestingly, there is evidence that not only hyperglycemia, but the glucose variability, the variability of the level of glucose, may be more important than persistent hyperglycemia in causing endothelial dysfunction. And that is scary, because people who are drinking beverages with sugar sweetened might be exposed. Now we know that they are exposed because of that effect to cardiovascular complications. And insulin resistance, actually even before hyperglycemia, we said that with hyperglycemia before, but now we are saying that insulin resistance per se, even before hyperglycemia, will lead to endothelial dysfunction, because oxidative stress and insulin resistance have direct relationship mediating diabetes cardiovascular complications, because insulin plays a critical role in maintaining the physiology of the endothelial dysfunction. These mechanisms play important roles in the development of cardiovascular disease of diabetes, and endothelial dysfunction has to be a prognostic sign of the future development of cardiovascular complications. And now we have to test endothelial dysfunction just to be able to protect our patients. There's an important, this is a very, very interesting article, actually, about diabetes and cardiovascular system. It's published in Nature, the very important and journal, just a couple of months ago. It reported a study published about thrombosis and in the Journal of Thrombosis and Vascular Pathology, which made a meta-analysis about the effect of acute hyperglycemia on the vascular function. They studied more than 39 studies to see the effect of the smooth muscle function during the euglycemia and hyperglycemia. They do an analysis specifically for the difference between studies that measured macrovascular versus microvascular endothelial dysfunction, and the results were interesting, because as a whole, endothelial function is impaired by acute induction of hyperglycemia, but vascular smooth muscle function is not. So the basic effect is the burden of the effect is just put on the endothelium rather than the smooth muscles. They specifically found that acute hyperglycemia impaired macrovascular more than microvascular complications. And both of them, actually, both microvascular and macrovascular are interrelated to each other. So it's difficult to separate them from each other. Regarding therapy, we have drugs which might improve cardiovascular endothelium, like ACE inhibitor, like statins, metformin, antioxidants, folate, PKC inhibitors, supplements like L-arginine, folic acid, polyphenols. There are a multitude, a number of therapies which might improve endothelial function. However, we don't have a single agent which can work alone in correction of endothelial dysfunction. Antioxidant therapy is very famous in trying to reverse or correct the endothelial dysfunction. However, well, there is a change in the opinion regarding antioxidants, especially vitamin E and vitamin C. It's almost certain that antioxidant therapy is an option that must be used in combination, but in combination with other therapies, not to be used alone. Combined insulin and antioxidants might be of help. This is about ascorbic acid. Nitric oxide-based therapies, they use nitric oxide itself, the area of deficiency, in cases of endothelial dysfunction. They used it both topically and systematically, and the result of topical administration of nitric oxide not only prevented new intimal hyperplasia following artery injury, but also reduced cell death. This, I'll skip that as well. Now, endothelial dysfunction and hypertension. You'll find the same mechanism, exactly the same mechanism, almost the same, of the dysfunction between hypertension and diabetes. Hypertension is very well known. It is the most important modifiable factor for cardiovascular complications. We can prevent it. We can treat it very efficiently. And it is very important because it's very highly prevalent all over the whole world. And fewer than half, less than half of the patients with hypertension know that they have hypertension. And out of this small population, only a small fraction of them is treated to the target, and the target of blood pressure is achieved with them. The etiology of hypertension is very complicated. This is just to stimulate physicians, just to do everything possible, just to treat those patients to the target, just to protect them from the serious cardiovascular complications. The endothelium is a major regulator of the vascular tone and major contributor to salt sensitivity, which is a major factor, as you all know, for hypertension. Endothelial cells produce a host of vasoactive substance with nitric oxide, again, is the most important in blood pressure regulation. Nitric oxide is continuously released by endothelial cells in response to flow-induced shear stress. The shear stress of high blood pressure causes increased production of nitric oxide. And interruption of nitric oxide production causes blood pressure elevation and development of hypertension in animals and humans. That's very well established and very well known. Studies to evaluate nitric oxide activity in humans have demonstrated decreased whole body production of nitric oxide in those patients with hypertension. Endothelial cells secrete a variety of vasoregulatory substances. We spoke about them, but in blood pressure and hypertension, there are important substances like vasodilators, like prostacyclin and endothelium-derived hyperpolarizing factor, and vasoconstrictors like endothelin-1, locally generated angiotensin II, and prostanoids thromboxane A2. and prostaglandin A2. These are the group of markers which are produced by the endothelium regarding blood pressure. Endothelin-1 is a potent vasoconstrictor that activates AT1 receptor, the ETA, in vascular smooth muscles. Circulating AT1, endothelin-1, levels are not consistently increased in hypertension, but there's a trend toward increased sensitivity of the vasculoconstrictive and hypertensive effect of endothelin-1. The receptor of endothelin-1 antagonists attenuate and abolish hypertension. Endothelial dysfunction plays an important role, a central role actually, in the pathogenesis of hypertension. There is an evidence that there is a hereditary element in those patients with hypertension, because normotensive offsprings of parents with hypertension often have impaired endothelium-dependent vasodilatation. Endothelial dysfunction in the setting of chronic hypertension is related to a combined and direct pressure-induced injury of their vessels. Again, I skipped that. Individuals who are salt sensitive might be very sensitive to the hemodynamic stress of increased blood volume, which results from increased sodium intake, leading to oxidative stress and limiting the bioavailability of nitric oxide. Angiotensin II, of course, the very well-known marker, along with other factors, including cyclic vascular stretch, and as a result of blood pressure change, endothelin-1, uric acid, systemic inflammation, noradrenaline, free fatty acids, tobacco smoking. There are a hell lot of factors that contribute and work together just to cause the problem. Now, you can see that the relationship between the basic mechanism behind the endothelial dysfunction in both diabetes and hypertension is almost identical. So if we come, I finished. That's my last slide. So if we come back to the original question, which was asked me to give you, you can find it in the program. Is endothelial damage caused by hyperglycemia more than hypertension? I can simply ask that question, because it's almost the same. Most of the time, they are combined there. So, and it depends what the meaning of important. Is it important because it is more prevalent, or important because it is more serious? So, I mean, you can't simply answer, this is more important and this is less important. You can't, surely you can say that both of them are important. We have to do every effort to protect our patient from cardiovascular complications of both hypertension and diabetes. Thank you.